maintaining your balance?
Looking a little hunchback?
Then you may be suffering from kyphosis.
Don't know what that is? Here at Humpback Hotline, we're here to point you in all the right directions and give you all the information you need to get a proper assessment and lead you a happier, healthy lifestyle with your
Kyphosis.
Okay, I'll be back later to check on you, Miss Jones. Hi, I'm a registered nurse. Kyphosis is a condition where the patient suffers from an exaggerated posterior curvature of the thoracic spine that causes significant back pain and limited mobility. First, I will assess a patient with a normal spinal curvature.
Come in.
Hi Morgan, how are you today?
Good, how are you?
I'm good. My name is Sarah. I'm going to be your nurse today. Do you mind if I assess your spine?
No.
Okay, can you please just stand up? And can you bend over and touch your toes? Okay, can you just let me know if you feel any types of pain or discomfort? I'm looking to make sure that size and contour are within normal limits and there are no deformities. Okay, Morgan, you can stand back up. Now I'm going to check the patient's range of motion. Morgan, can you bend to the right? Okay, now to the left. Okay, now can you rotate to the right and to the left? Can you bend back for me? Okay, can you bend forward? Okay. As you can see, this patient demonstrates a full range of motion. As you can see, after palpating the spine, it was established that the patient has no tenderness or spasms in the vertebral muscles. The patient also demonstrates a full range of motion. Now, let's take a look at a patient who does have kyphosis.
Come in.
Hi Alexa, how are you today?
Good, how are you?
I'm good. My name is Sarah. I'm going to be your nurse today. Do you mind if I assess your spine?
Nope.
Okay, can you bend over and touch your toes? Okay, just let me know if you feel any pain or discomfort, okay?
Okay. Right there it hurts.
Right here?
Mm-hmm.
Okay, I'm going to continue, okay?
Okay.
You can stand back up. In this patient, there are deformities in the vertebrae. I can also feel spasms in the patient's vertebral muscles. The patient's vertebral area is warm also and swollen. The patient also experiences discomfort in the vertebral area as expressed by her pain when I palpated her upper spine. These are common symptoms of kyphosis. Okay, Alexa, I'm going to continue with your assessment. Can you just turn around for me? Can you bend to the right? Okay, can you bend to the left? Can you rotate yourself to the right? Okay, can you rotate to the left? Try and bend forward at your waist. Okay, try and bend backward at your waist. Okay, thank you. Notice how the patient with kyphosis was stiff in her movement and it was more difficult for her to complete the full range of motion exercises. The symptoms that this patient displayed are synonymous with kyphosis. Now that you have seen both a normal and a kyphosis patient assessed, note the differences between the two and use these techniques in your next assessment. Kyphosis is more common in people who are overweight or who are of an older age. Congenital kyphosis is also a cause of a curvature in children and infants. These patients will get surgery to solve their problem. As you've been informed by your doctor, you show signs and symptoms of kyphosis. If your pain ever becomes too overwhelming or uncomfortable, therapy will be your best option because of your age. If your balance ever becomes too off-center, a cane or a walker can be used to help you with these problems. Depending on the severity of the kyphosis in the patient, they could become a fall risk. If need be, a nurse could come to the home and assess for fall risk. To avoid furthering complications, the patient should exercise to relieve lower extremity contractures and strengthen abdominal muscles. Also, practicing normal posture when standing and sitting will help. Overall, kyphosis is a manageable condition, and in most cases, the patient is able to continue to live a normal, happy, and healthy lifestyle.
We hope the Hunchback Hotline educated you about the symptoms and assessment of kyphosis.
And remember, the Hunchback Hotline always has your back.
Robber's got a quick hand.